Hello, in this module on barrier contraception, I am going to discuss male condom. Condom is the most reliable and the most important family planning method. It is a coital dependent barrier contraceptive method that does not interfere with fertility. Male condoms are now referred to as external condoms as compared to female condoms, which are referred to as internal condoms. At the outset, on a lighter mode, I will start with a question: which is the best contraceptive method? This meme reveals the answer very aptly. Are you aware that colloquially condoms are referred to by various names? In Hindi, it is known as Chota Chhatri, Suraksha Kavach, or Gubbara. In English also, it has many different names such as a helmet, Johnny, raincoat, sheath, and French leather. When describing the male condom in Viva, adhere to the following protocol. First, describe the anatomy of the contraceptive device. Next, describe its mechanism of action. Then illustrate how to apply the condom, what precautions should be taken during its use, and then talk of its advantages and disadvantages, followed by its failure rate, and lastly, other non-contraceptive uses of the condom. As per the protocol, I will first talk about the anatomy of a male condom. Condom is a circular cylinder with a closed tip and an open proximal end having an integrated rim. Most condoms have a teat or a nipple at the tip. Most are lubricated. They have an expiration date of about 3 to 5 years from the date of manufacture. Condoms are made of latex rubber, natural membranes, and other synthetic materials. Approximately 80% are made from natural rubber latex. Less than 5% of condoms are made from intestinal cecum of lambs, which is known as natural skin or natural membrane or lambskin condom. However, they may not provide the same level of protection against sexually transmitted infections as latex condoms provide and should not be recommended for this purpose. The remaining 15% are made of synthetic material, that is nitrile, which is synthetic latex. For couples with latex allergies, non-latex condoms are now available. These are made from polyisoprene, a revolutionary non-latex material that provides a totally natural feeling for both partners. Male condoms are available in various sizes. The length varies from 160 to 205 millimeters and the width from 48 to 58 millimeters and thickness from 0.03 to 0.08 millimeters. The market preparations are labeled as small, medium, large, extra large, and of course for the lucky ones, XXL. To increase friction and therefore pleasure, ribbed, dotted, and contoured condoms are also available as shown here. Condoms are also available in various colors as shown here. That is at least 7, one for each night of the week. If they can be available in different colors, then why not different flavors? To satisfy different tastes of consumers, they are also available in different flavors. The favorite flavors are strawberry, vanilla, and chocolate. They are also available in typical Indian flavors such as mango, chicken tikka masala, curried goat, meeta pan, etc. So then, what's your favorite flavor? What about medicated condoms? Well, if you can have medicated IUDs, then why not medicated male condoms? Today, having a cold or a flu cannot be an excuse for not having sex. Medicated condoms such as Vicks VapoRub rubbers are now available. Even lack of electricity, which is common in rural India, is no problem. Condoms that glow in the dark are now available in India. Male condoms that are supplied freely by Indian government are called Nirod, which in Sanskrit means prevention. In 1968, Nirod campaign was launched in India on a national basis. It is manufactured in Hindustan Latex Company Trivandrum and London Rubber Industries in Madras. The condom supplied by the Family Planning Association of India is called as Sangam. Another Indian brand available is called Suraksha. Next, I will talk about the mechanism of action. Male condoms act as a mechanical barrier for both sperms and microorganisms. Thus, they prevent pregnancy as well as certain sexually transmitted infections. This is known as dual protection. However, one must remember that condoms cannot protect against sexually transmitted infections spread by skin to skin contact, such as herpes and HPV. Also note that non-latex condoms do not provide protection against sexually transmitted infections. Now I will talk about the role of condoms in HIV prevention. Although it is mentioned that condom prevents HIV, it must be noted that the actual HIV particle size is so small that an individual HIV viral particle can pass through the pores of latex, unlike the large sperm which cannot. So, how does a condom prevent HIV? The answer is, for HIV infection to establish, large viral load must be passed into the female genital tract, which is prevented by the condom. Thus, it should be noted that a male condom is only 85% effective in preventing HIV and not 100%. If anyone were to ask me which is the most important aspect of discussing male condoms, my answer would be it's very important to know the precautions during use of a condom. So I'm going to dwell in great details about this. Some of the precautions before use are: do not use a condom that is rolled backwards or damaged or too old. Condoms must be stored in a cool, dry place. Some of the precautions which should be taken during use are: condom must be rolled onto the penis before any contact with the female genital tract occurs. Do not use teeth, a pair of scissors or sharp objects to open a condom packet. When applying the condom, the rolled up ring should be outside. Pinch the teeth. The foreskin should be retracted and then applied. Never use oil-based lubricants. Use only water or silicone-based lubricants. There are some special precautions that must be followed. A new condom should be used from beginning to end with each act of intercourse. If the condom breaks or falls off during intercourse but before ejaculation, it should be replaced with a new condom. New condoms should also be used for prolonged intercourse and for different types of intercourse within a single session. For example, change the condom after anal sex if vaginal sex is also planned. After the act, withdraw the condom and the penis while it is still erect. Roll it out from the shaft as shown in this clip and then dispose it in a trash can. Never flush it down a toilet. Needless to say, this condom sense is like common sense, not so common. Now I will address the question: does wearing two condoms increase protection? Well, the answer is no. Using two condoms at once is considered unsafe because it increases the chances of ripping or tearing. The friction between the condoms during sex makes them even more likely to tear or break. It's like wearing two wristwatches at a time. There's a saying, never double bag it. External condoms should be stored in cool and dry place out of direct sunlight as excessive heat will weaken the latex. However, latex condoms can probably be carried for convenience in a wallet for up to 1 month. Avoid excessive bending or compression of condoms. What about reusing condoms? Although, as per medical advice, it is strictly forbidden to reuse standard condoms, in actual practice, condoms are reused, not only in a poor country like rural India, but also in United States of America. Of course, now specially made reusable condoms are available in some countries. What about concomitant use of lubricants and or medications with condoms? Water-based lubricants such as KY jelly, saliva, glycerin, and most silicone-based lubricants can be used with latex condoms. But oil-based lubricants reduce latex condom integrity and may facilitate breakage. Common oil-based products that should not be used along with latex condoms include baby oil, cold creams, edible oils such as olive oil, peanut, corn, sunflower, canola or coconut oil, butter, cocoa, margarine, whipped cream, hand and baby lotions, massage oils, petroleum jelly, rubbing alcohol, lotions and mineral oils, etc. Now watch this short instruction video on how to use a condom.
Hi, today we're going to teach you how to put on a male condom. The first step is to look at the expiration date. This is typically found on the back in red letters. In this one, it says 2014-06. This means June 2014, so we're good to go. The next step is we're going to open the condom. There are two edges to the condom. There's a bumpy edge with triangles at the top and a straight edge. You want to be sure to open on the bumpy edge. Next step is to push the condom to the side. As you do this, you can feel for air bubbles. If there's no air bubbles, it means that your condom has been punctured and that it's no longer good for use. So if you don't feel an air bubble, throw it away. Luckily, we have an air bubble. So from the bumpy edge, we're going to tear it with our fingers, not our teeth. If you tear it with your teeth, you have a greater chance of breaking the condom. When you take the condom out, you'll find that there are two ways to look at the condom. One way has a little hat, and it looks like a sombrero. This is the correct way that you want to hold your condom. The incorrect way is inside out, and it looks like the top of a baby bottle. If you find that you pull the condom out like this and you try to put it on the penis, you will not be able to unroll it. If you put the condom on the penis in the baby bottle position, do not flip the condom over. In that case, throw the condom away. Luckily, I did not touch the top of the penis, so I am still able to flip the condom inside out like the sombrero and do it correctly. At the top, I want to take one hand and pinch it. This is to pinch out any air. On an erect penis, or a penis that is hard, put the condom at the tip of the penis with one hand, pinching the top, and with the other hand, roll the condom down to the base of the penis. Like this. Once you've unrolled the condom, you'll see that at the very tip, there is no air, and this is to catch the semen once your partner ejaculates. To insert the penis with the condom into the vagina or anus, be sure to hold down the base of the condom to make sure that it stays on and is properly on the penis. After ejaculation, unroll the condom off an erect penis or while the penis is still hard. From this, you'll want to tie the top like so and throw it away into a trash can. Never flush it down the toilet because this may clog your toilet.
When used perfectly and consistently, the failure rate of a male condom is 3 to 4%. But with a typical use, the failure rate is as high as 12 to 18%. Therefore, male condoms are considered as moderately effective in preventing pregnancy. If male condoms are moderately effective, it is imperative to discuss some of the causes of failure. These are: it may burst or break, it may slip out during use, a condom past the expiry date may have been used, one may reuse a condom, inconsistent use, manufacturing defect, or it may be damaged after manufacture. Advantages of a condom are: it is reliable, relatively inexpensive, it is light, compact, and disposable, it is effective immediately, no method related health risks, no systemic side effects, no medical supervision required, no follow up required. It can be used as a backup method to other methods. It is widely available in pharmacies and community shops. No prescription or medical assessment is necessary. There is always another side to a coin. Disadvantages of a male condom are: it is user dependent, disposal may be a problem, man under the influence of alcohol may omit to use it, it may reduce sensitivity of penis, adequate storage must be available, it may rupture during use leading to failure, and of course, it is moderately effective. Condoms are pre-lubricated with a small amount of spermicide called non-oxygenile, that is N9. They are no more effective than other lubricated condoms but have a high cost and shorter shelf life and may cause adverse side effects in users. In one study, spermicidal condom was associated with increased risk of urinary tract infections in young female participants. Given these disadvantages and the absence of any advantage of spermicidal condoms, they are not recommended for use. It is highly recommended that women who are taking oral contraceptive pills utilize condoms as a form of dual contraception. This approach effectively prevents pregnancy while simultaneously safeguarding against the transmission of sexually transmitted infections, that is, STIs. And now, the most favorite question of examiners in Viva: what are the other uses of male condoms? Condoms have a variety of uses in obstetrics and gynecology practice. These are: as a TVS probe cover, during treatment of both partners for trichomonas vaginitis, to reduce anti-sperm antibody levels, as a vaginoplasty mold, Shivka's condom catheter, and condom catheter in males. As you all know, especially the millennial boys and girls, condoms have other interesting non-medical uses as shown here in these pictures. Fashion garments made entirely out of condoms have been produced. If one were to make an advertising campaign for condom use in India in Hindi, what would it be? Zindagi na milegi dobara, use karo gubbara. This reminds me of an interesting quote: a condom is useless if there is a tiny prick in it. In conclusion, I will say that the key to successful use of a male condom as a barrier contraceptive is consistent and correct use by a motivated couple in a monogamous relationship. So, Use one every time you have sex. If you want to know more about this topic or any other topic in obstetrics and gynecology, please refer to my books Modern Gynecology, Modern Obstetrics, and Practical Obstetrics and Gynecology, and other books. For purchase inquiries, contact me on this WhatsApp number. I have also published 2 question answer books which are particularly useful for exam going students. These are Clinical Cases in Obstetrics, 1000 plus questions and answers, and Clinical Cases in Gynecology, 1000 plus questions and answers. You can also follow me on other social media platforms like Facebook or Meta, Blogspot, and Instagram. The links are given here. If you enjoyed this video, hit the like button, share it with your friends, and also subscribe to my channel for more videos like this. Thank you for watching.